being a double major, triple major, quadruple major, single major, no major, whatever, it doesn't matter. At the end of the day, you need/want a good GPA to show medical schools that you are academically capable of doing well in medical school. Hello, everybody. This is fun. This is new. This is different. Unfortunately, if you're joining us, Alexander, Angela, Brianna, Daniel, Evelyn, Claire, number one, it's really cool that I have this like lower thirds. I have no idea how it got there, or how to get rid of it, but hey, whatever. I am solo today. We had a physician all lined up for today, and she is sick and can't talk. So that didn't work for our first eShadowing here on Zoom, but we wanted to do it anyway to test it out, see how it works. Most of you should be pretty familiar with how Zoom works at this point, I would hope. You can raise your hand if you want to ask questions. You can, and I'll unmute you. You can use the normal kind of chat function. Make sure that if you want to ask questions or just post something to everyone, that you change who you are sending your message to. There are 91 of you here right now. So we're going to do today's session. It's just going to be a general Q&A session with me for kind of as long as you want it to be. You can ask about my path to medicine. We can talk about general pre-med stuff. We can kind of talk about anything and everything. So if you have a question, raise your hand and I will allow you to unmute and ask your question. And we'll go from there. Lisa, let's see, allow to talk. Hello there.
Hi, Dr. Gray. How are you?
I'm wonderful. How are you?
I'm good. I had a personal question for you, actually.
Yeah.
So, I know there are lots of people who have like a dead set idea of what specialty they wanted to go in, but what was the specialty that you almost switched to before settling into what you wanted to do?
Yeah, so my path is weird for a couple of reasons. I went in dead set on wanting to be an orthopedic surgeon. I generally don't recommend going in with like, I'm going to be, because the data shows that 75% of people change their mind anyway. But I was dead set on going into ortho. I played baseball. I originally wanted to be a baseball player. I hurt my shoulder. I went through rehab, physical therapy, all that fun stuff. And I was like, ooh, my original thought was actually physical therapy to go even further back. And then I dissected a cat in my high school senior biology class. And I was like, okay, I'm going to cut things because that's what I like to do. And I would rather not be arrested for it. So I guess I should do it legally as a surgeon. And so I went the ortho route from there. So going through medical school, there was one specialty that changed my mind. The one specialty was OBGYN. There was something about the medicine of OBGYN, the patients in that world, that just clicked with me. Ultimately, I decided not to go down that path, but that was the one. And so I'm a weirdo because I did the Air Force scholarship during medical school. And so I came out of medical school, wanted to be an orthopedic surgeon, but the Air Force had different plans for me. So that's my journey.
Cool. Okay. Thank you. I was just curious.
Yeah. Thank you for being curious. All right. Let's keep going here. So we'll do that, and then we'll come here. Carla, hello.
I just had a question about MCAT and how do you think we should, how do you think we should, for one, study? Because I know there's a lot of material, but it's not enough to know. You have to know how to apply it for the MCAT, especially with the passages. And two, how should we know Like, when is our score good enough, or should we take it again?
So how do you know if your score is good enough is the hardest question to answer, because everyone is going to go in with different levels of preparedness, different levels of ability to do well on big standardized tests like that, and different aspirations in terms of potentially what medical schools they want to go to. Because even though I don't believe in tiers of medical schools, we know that for some of those really, really good medical schools out there, their stats are pretty crazy in terms of potentially what they're looking for. Now, that doesn't mean if you don't reach kind of what their published median numbers are, or even 10th percentile numbers are, doesn't mean you shouldn't or can't apply to those schools if you want to go there. So that's the hardest one to answer. So I think you should just figure out the number that you want. The number, kind of a minimum number, if you opened up your MCAT score that day and was like, yeah, no, I'm not applying with that number. So just figure out where to go from there. And just make a number, right? So the average matriculated MCAT score is a 511.7, I believe, according to the AAMC. So that's just AAMC AMCAS data. But in terms of actually integrating that information, I think it's a great question, because the biggest mistake that students make is studying, aka reading a book over and over and over again, doing content review, but not actually integrating that content into questions. So just taking lots of questions, whether it's Q banks from any of the test prep companies, doing something like UWorld, where they have probably the best Q bank out there, and doing full-length practice exams. That's really the key to it all.
Thank you.
You're welcome. All right, Julian, hello. Let me allow you to talk.
Hey, can you hear me?
I can. What's up?
So I'm applying this cycle and I'm looking for people to write reference letters for me. And I'm wondering, does it matter if someone knows you really well, or will it look better, for example, if I have my department head write me a letter or my research professor? What sort of things should I look for?
So the people who you want to write your letter are the people who know you the best, period. So not who has the best credentials, not who has the best title, not who's from the most prestigious institution. It's who knows you the best at the end of the day. And then as you think about it, right, so the AAMC has the 15 core competencies. And as you think about those, the things that you should be potentially thinking about are any of those potential letter writers, do they maybe know some of you in better ways, right? If one of the core competencies is interpersonal communication, has one of your letter writers really seen you be able to communicate well with other people? And you potentially can go to that letter writer and say, hey, Dr. Smith, whoever, I would really love a letter recommendation from you. I believe you've seen me in these specific situations, which I think potentially speaks to my interpersonal communication skills. If you can highlight that potentially in my letter, can you do so?
Great, that helps a lot. Thanks.
Yeah. All right. Gani, hello.
Hey, Dr. Rick, can you hear me?
I can.
Alrighty. I just had a kind of personal question regarding my journey, but I am a non-trad just off of age and what I did prior to starting school. And I was wondering, I'm transferring this coming semester to a university from community college. And I was wondering if research should be something that I should focus on, and like any tips or tricks that I can kind of utilize to, get my foot in the door, if that matters, I mean.
For research?
Right.
So it's funny. I just recorded an episode about research that's going out Wednesday because I'm actually part of a team that's we're putting together, or have put together a big pre-med survey to try to understand pre-meds a little bit more.
Yeah.
Ultimately, the question is, are you interested in research? Do you want to do research, or are you doing it to just check a box? So looking at that question alone, if you're interested in doing research, then the question is, what type of research are you interested in? Do you want to do wet lab research? Do you want to do social science research? Do you want to do whatever?
Right.
Again, the episode of the pre-med years that's coming out Wednesday may be an interesting episode for you to listen to, because I ask some of those questions about, like, how do you start to think about asking questions and all that stuff, and potentially finding people who are interested in those same topics, who may be doing those types of things, and just go from there. But research to me is one of the most overrated parts of the application process, the pre-med process, according to Premeds.
Gotcha.
So take that for what it's worth.
Okay. No, I really do appreciate it. Thank you.
Yeah, you're welcome. All right. Arian.
Hi, Dr. Gray. How are you?
I'm good. How are you?
I'm good. So I'm a Canadian applicant applying next cycle to US schools, and I wanted to ask about clinical experience. As you know, it's really hard to get like actual clinical experience with patients in Canada. And I do volunteer in 2 hospitals, but again, there's not much patient interaction. And I just wanted to know, how is that viewed by US medical schools?
Yeah, it's always the hardest question. Our friends up north, just the typical pre-med process is very different, because shadowing typically isn't a thing. I think it's actually banned in one province. And then clinical experience is just not viewed the same. So at the end of the day, the question is, are medical schools here in the US going to, number one, understand it? And I think they do, but are they okay with it at the end of the day? And I don't know the answer to that. Unfortunately, I think number one, I don't think there are enough Canadian students applying to US medical schools to really know kind of large scale what the general consensus is. And the students, I'm biased because the students that I know, who I've worked with, who have gotten into US medical schools, generally have found a way to get clinical experience in shadowing. And so at the end of the day, it's hard to give that answer.
Okay.
So what you should potentially do as a Canadian is reach out to some of the schools you're interested in and say, hey, like, as you may be aware of, shadowing clinical experience, not easy here. I know it's typically a very important thing for US pre-med students. Help. What do I do?
Yeah. I was talking to a counselor, and like they suggested me just going to the US just to get clinical experience, which I don't think.
Yeah. And again, that's like, that comes from a place of privilege of like, oh, like, just go to the US and hang out for a little while. And like, it's not that easy for everyone.
Exactly. Yeah.
Yeah. So I would just go ask questions directly from the source, from the medical schools.
And I just had another question about research. I know somebody already asked. If you don't just like research, your take on it as just don't do it, right? Like, I know most people just do it just to do it, just as a checkbox. But if you just don't like research, you don't enjoy doing it, you shouldn't be doing it, right?
Then don't do it. Yeah. Because what are you going to get out of it? You're like, I'm doing it to do it. That's not very fun.
Okay. Thank you so much.
Yes. All right. I'm still trying to figure out how to get this little lower thirds name tag off. I don't think it needs to be up there the whole time, but I've never seen it before, and I don't know how to do it. So anyway, Etan.
Oh, hey, Dr. Gray. Thanks for pronouncing my name correctly, by the way.
You're welcome.
So this is kind of like a personal question. It's kind of a position that I'm at right now. what was your transition like into medical school? Like,
Horrible.
like, did you feel prepared? What was like?
No. Yeah. So I'll give you my raw, honest, like it was miserable. I was miserable. So I had taken 3 years off between undergrad and medical school. I didn't get in the first time I applied. So I took a year off, applied, got in, and then deferred a year, and then started medical school. And it was miserable. Number one, I went in with the wrong mindset of like, oh, I want to be an orthopedic surgeon. Why am I learning about histology? This has nothing to do with orthopedics. So super closed-minded, super ignorant mindset that I had. So I failed my first, and I don't know if it was technically my first med school test, because we took histology and anatomy and physiology together at the first block, and we took tests right around the same time. I got an A in the anatomy test because that was like, oh, anatomy, I want to be an orthopedic surgeon, I need to know anatomy. And actually I just loved anatomy anyway. And then the histology came and I'm like, yeah, no. And I failed my first histology test, and it was miserable. I never read a bunch growing up. I didn't read for fun. I didn't read well for school. I didn't have to work hard really to get good grades in undergrad. And it really showed coming in, both having taken 3 years off and having really, really poor study skills. I didn't do well. And so I really loved after the first 2 years, switching to the clinical years, because while there was still a lot of reading and learning, it was much more hands-on, much more applicable to what I wanted to do. And so one of the biggest lessons learned that I try to tell everyone now is understand the curriculum that you're going into. I think if I had gone to a systems-based curriculum, I probably would have done a lot better from a grade perspective in medical school, and potentially from a happiness perspective. I went to a very traditional curriculum school where you learned anatomy all by itself, pharmacology all by itself, pathology all by itself, all siloed information, versus a systems-based curriculum is you go and you learn the cardiovascular system, and you learn the anatomy, the physiology, the pathophysiology, the pharmacology, all related to the cardiovascular system. And I think that would have worked much better for my brain.
Yeah. Well, thanks for that. And by the way, during my special master program, I also got an F for my first histology test. So you're not.
Yeah. Nice. Good job. All right. Let's keep rocking. Hello, Kelley Freeman.
Well, hello.
Hello.
I was like, I'm not going to get called on. Oh, I got called on.
You got called on. Why wouldn't you get called on?
I don't know. I haven't done this before.
Oh.
How are you?
I'm wonderful. How are you?
Good, good. So I'm a non-trad 44-year-old community college transfer into a UC school. And I had a lot of stops and starts. Obviously, I started college right after high school, left for other reasons, then went to art school like over a decade ago. So I'm wondering how much those grades really come into play for medical apps.
Yeah.
3.6 GPA for those, and then I'm gonna like
that's not bad
for everything else.
3.6 isn't bad.
Well, you know, I mean, I'm just
a 3.6 isn't bad. Like if you were like, I got a 2.6, then hey, let's.
That was high school. So.
No. Yeah, I wouldn't worry about a 3.6. All grades go into your application.
Right.
It's going to be up to the medical schools to determine kind of how they view older grades, newer grades, different non-science grades, whatever. But a 3.6 is nothing to worry about.
Okay. All right. I'm just stressing.
You're part of this new organization I've created. I need a tagline and I need a logo, and we need to get this going. But you're part of the OPC, the Overthinking Premed Club.
Yes.
as Jessica knows. As she's common. Yes. So welcome to the club.
Thank you. I appreciate the invite.
I am not only the president, I am also a member.
Perfect. Thank you
Awesome.
so much. I appreciate that.
You're welcome.
All right. Bye.
All right. Patrick.
Hello, Dr. Gray.
Hello there.
So I actually have a lot of questions, but I'll just limit it to one, unless you're okay with that. A lot of them I think are pretty short answer. So first, piggybacking on what Kelley was just saying. So I'm about to submit my applications, and so I haven't added to my transcripts my classes. I'm 40 years old, and I've got classes that I took in my 20s.
Yep.
I only included everything that I basically done recently that has gone towards my degree.
No, every single class ever.
Okay, cool. And then another question real quick. How many schools do you think is a good number to shoot for on your application?
How much money and time do you have?
Yeah, right.
that's really 500. Yeah. So I'll tell you the average. The average now is 18, I believe, for the AAMC for AMCAS. For the DO application, it's 9, I believe. And I don't know what TMDSAS is. So if you put those two numbers together, if you're applying to both, then the average you go, hey, 27. But that's a lot of schools. I typically say 25 as kind of the most, because it's a lot of time, it's a lot of money. I think there's always a concern of applying to too little, which I think is a valid concern. If you're applying to 3 or 5, but 10 or 15, I don't think, if you apply very strategically in terms of schools where you're going to be a good fit, both from just a mission standpoint, and notice how I'm not talking about stats at all, then I think you're probably okay there.
Yeah, I watched one of your recent videos and basically went through all of the missions at the schools that I was interested in, and just checked to make sure I was a fit.
Yeah.
But I think I have 17 between DO and MD right now. So
perfect.
Yeah. Okay.
Awesome. Raise your hand again if you wanna chat some more. We'll keep going. Reggie, hello. I cannot hear you, Reggie. I see you're unmuted. There you are.
Can you hear me now?
Yes.
Wow. First of all, big fan. I'm a little nervous right now.
What are you nervous about?
Just ever since the eShadowing days, I never thought I would talk to you ever.
Oh, well, you are.
But,
you are. What's going on? I appreciate that.
Okay. So great stuff. I watch a lot of your YouTube videos, and of course eShadowing.
Yeah.
So I had questions about my situation right now. Okay, so I'm a pre-med, and I am a senior. And the major I chose is a little, it's too much stuff going on. I wish I chose biology because, it would have been easier, the overlap. But I'm asking because I signed up to take the MCAT this summer on September 10th, and I have not studied, right? I'll start studying now.
Okay.
Is that enough time? I've seen some of your videos where it says 3 to 6 months is the right range to go for, but I have been a workshop leader for organic chemistry, so I don't know. Do you think I got a chance, or am I doomed?
Yeah, so 3 to 6 months is kind of typical. 3 to 4 months, I think, is the general kind of thing that we talk about. At the end of the day, the question is, what does the rest of your time commitment look like? If you are available mostly full time to study for the MCAT, then you may need a little bit less. If you're working full time, taking classes, then maybe you need a little bit more. So it just depends.
And maybe this is an extension of that. How long should I study per day? Let's say, given that I've not taken any classes, no work, what is an average?
Yeah, I think I don't think there is an average that I can give you. I think if you can make it full time and study for 8 hours, great. Not everyone can do that, so it just depends. But 8 hours very inefficiently, where you're checking on Instagram every 2 minutes to see if I'm live so you can hang out with me, like that's not very effective compared to your phone is locked away and you're not distracted and you're super focused.
Guilty. Okay. One follow-up question.
Yeah.
One follow-up question. About my clinicals. I have not done any clinical research for that matter. But for clinicals, I'm thinking about caregiving since my parents did it. And I don't know if that would be considered, since there's no doctor overlooking you, maybe a nurse or something, but
still clinical. Yeah, it's a big misconception that there has to be a doctor kind of overseeing you or with you to make it clinical, but that's not the case. As long as you're taking care of a person in some sort of clinical way, and being a caregiver is potentially that. Now, I saw a parent recently post about a newer organization, it seemed like in a very specific regional setting, that talked about caregiving and, it's great for pre-meds and pre-PA students. And it talked about like, you can cook meals and transport them and do housekeeping. And I'm like, that's not clinical stuff. So you just be careful with what kind of caregiving entails.
Okay, for sure. Wow. Thank you so much.
Yeah, you're welcome. All right. Lower hand. Carla, hello.
So I kind of have two questions. One, finding off of the GPA stuff.
Yeah.
So I am a double major.
Okay.
Who just graduated less than a month ago.
Okay.
And who wasn't thinking that I was gonna do science just because I'm disabled and I was told not to do it while I was in high school.
Okay.
And that made me like decide that I wasn't gonna do science. And I went into literature and stayed in literature until a professor basically yelled out at me saying, you like science and you need to do it regardless of whether you're disabled or not. As she said it on that
professor.
Huh?
Good on that professor.
Thank you. And she cursed me out for it. And I decided to decide her to basically to follow her advice.
Okay.
But that meant I didn't want to leave my literature major, and I did it. That meant I have both majors. I graduated in time. I don't know if I'm gonna take 1, 2, 3 years off because of the classes I didn't take, because I didn't start until sophomore year. And that means I'm double major, and I don't know what a good GPA quote unquote looks like right now.
Yeah, so
overall.
I'll stop you. So being a double major, triple major, quadruple major, single major, no major, whatever, it doesn't matter. At the end of the day, you need / want a good GPA to show medical schools that you are academically capable of doing well in medical school. So don't think that just because you have a double major gives you any sort of flexibility in terms of, well, my GPA is lower, but I was a double major.
No, I don't mean that. I mean, what kind of GPA are we looking for?
4.0.
Huh? 4.0.
4.0.
What if we don't have that?
Then 3.99. And then if you don't have
Okay.
that, then a 3.98. And if you don't have that, then a 3.97. You get my
What
drift. You want as high of a GPA as possible.
is there any GPA that if we have, we shouldn't apply for?
It depends. I've seen 2.5 GPA students get in, but it just saying that final number completely ignores the story behind that number. So if you ever hear me talk about the story behind the number, it's one of the reasons that we built Mapped and have the free GPA calculator there, where you can graph everything and show an upward trend. Because maybe you struggled in your first and second year, but your third and fourth year, and maybe your a post-bac year, you've gotten close to a 4.0, but your overall final number is still a 2.8 or 2.9 or 3.0, whatever it may be. And so you can't look at just that final number. The trends and the story behind that number are just as important.
Okay, so just it's also the way that you got to that whatever number it is.
Correct.
Okay, thank you.
You're welcome. I've seen a few questions about kind of the change in eShadowing and certificates and all of that. So after lots and lots of weeks and probably several months of talking about what are we going to do with eShadowing moving forward now that the pandemic is kind of slowing down a little bit, shadowing in real life opportunities are becoming more available. And then just from a support standpoint on our tech side, where students weren't getting shadowing certificates, their hours were not correct according to them, but according to us, they were. We just decided, you know what, why are we doing something different? That I kind of arbitrarily at the beginning of the pandemic, when I started eShadowing, was like, let's offer a certificate to show that it's more official to medical schools. And I think now that we see that medical schools are like, great, like you got virtual shadowing, we'll take it. They don't need proof, just like they don't need proof for any other shadowing that you do or any other activity that you do. So we've decided, now that we have seen what medical schools are doing, now that kind of in-person shadowing is opening up, we're to the point where it's like, report your hours as you would for anything else, and it's just based on the honor system. So as of whenever, we've shut down all certificate stuff. So if you aren't sure because we told you that we were going to track all of your hours, you can either estimate or stay tuned. I think we're going to try to figure out a way to try to give you a number of hours without actually giving you a certificate. And so stay tuned for that. But at the end of the day, I would probably just estimate how many hours you think you've had to this point and just keep track moving forward. So that's the big change. We're a small team, and there's a lot of resources being taken up by eShadowing. So that's that. Kelsey, hello.
Hi, Dr. Gray. How are you?
Wonderful. How are you?
Excellent. I'm excited to be here. I would first like to say I fall under the OPC group. So
nice. Welcome to the club.
I am a non-traditional student, and I have just been researching schools and noticing, and then also saw something that you posted that said medical schools like in-state students, primarily, or in-state residents.
Potentially. Public medical schools.
Okay.
Typically.
I live in Alaska.
Yeah.
So we don't have that. The only thing we have
you
is
have
the
WAMI
program.
Yeah.
But I want to apply to several schools. So is there anything aside from the scores and the general, you need to do these things for your application, that you would recommend to help that piece, I guess?
I think you're just like any other student applying to out-of-state schools. Make sure that you're educated on the schools that you're applying to.
Mhm.
If they accept out-of-state students, if they do accept out-of-state students, how many do they accept? What's their kind of breakdown of number of out-of-state applications versus number of out-of-state interviews versus number of out-of-state matriculants, as the MSAR kind of puts it. And you just have to be educated and make an informed decision when it comes to that. So just you have to do a lot of research and figure out what schools you want to apply to, and just look at what their numbers are. And if they don't look like they're out-of-state friendly, potentially call them and say, hey, I see that you're not super out-of-state friendly. I'm from Alaska. Do you give any love to us Alaskans? So
that was my other question was, is it annoying to call them? Because I would love to do that, but I also don't want to get on their hit list. So.
Yeah, and it just depends, right?
Okay.
Most admissions committees are pretty small, and so it may be a hindrance to them. But if you're very interested in that school, and I think you're open and honest about, like, hey, I'm really interested in your school because of XYZ, and I'm from Alaska, do you kind of consider us a little bit different since we don't have a state school?
Okay. Awesome. Thank you.
Yeah, you're welcome. Guess who's back? Patrick's
Back
back
again.
What's up?
Hey, my son might interrupt. He just discovered he has a voice about 2 days ago.
Yes,
so.
I heard him earlier. So
Yeah.
how old is he?
He is almost 4 months.
Awesome.
Yeah. So my next question is just real quickly, like, how much clinical experience is a good amount? I think I have about 2,000 hours that I'm claiming. Does that seem like a good number, or should I really?
So just like the GPA question, I can't really answer it because I don't know what the story behind those 2,000 hours is.
Okay.
Are the 2,000 hours from 10 years ago and you haven't done anything since?
No.
Or are the 2,000 hours spread over 5 years and you're still doing something?
Mm-hmm. Okay. Yeah, I mean, I'm a stay-at-home dad currently because we couldn't afford childcare. So I'm trying to do a lot of virtual shadowing.
Okay.
I just had to quit my job as a medical scribe.
Okay.
And that was really fun. I feel like that was like really good as far as a learning, but also just, I don't know.
Yeah. And are you applying this cycle?
I am. Yeah, I'm actually just finished everything except for now I got to get my transcripts from, 20 years ago or whatever.
Yeah.
But everything else is done, and I was going to submit it with my fiance tonight. We were going to go over it. And
so the question is, what are you putting for your anticipated hours moving forward for any sort of clinical or shadowing?
Right.
And if it's 0, then I would be careful.
Oh yeah, no, I definitely put it in that I'm going to be shadowing as anticipated hours. I think I put like 75 or 100 currently.
Okay.
And then I guess a backup question, because I am planning to look for a job. We're on a wait list for childcare.
Okay.
Should I put that in the application that I'm planning to get a job at some point that's in a clinical field, or is that, because I feel like that's like, who knows when that will be or what it will be. And
yeah,
I'd rather talk about what I'm actually doing rather than maybe.
Yeah. So I haven't looked at the new instruction manual about how to use that anticipated hours. I glanced at it, and you can put 0 hours for completed and then put hours for anticipated. If potentially there's an opportunity to go back and work as a scribe, then putting anticipated hours as a scribe. If you're like, well, I'm not going to go back to be a scribe, I'm going to go do something else, then potentially putting that as an activity with anticipated hours. I don't think, and again, we get into a weird situation where it's like, how many people can lie about this and kind of cook the books a little bit. But yeah. I think it hurts you more than helps you to not have anything on there in terms of anticipated clinical hours.
Okay. And I did mention that I'm a stay-at-home dad now, and that's why I quit my job as a medical scribe. And I don't know if
you mentioned that in your activity description.
Very briefly, yes, just like a 1-sentence thing, just to be like, I would still be working with this doctor, but I had to, go become a stay-at-home dad due to childcare.
Yeah.
So, okay.
Anything else?
Thank you very much.
Andrea? Hello, hello.
Hi,
Hello. How do you pronounce your name?
Andrea.
Andrea.
Yeah, it's kind of
Hello.
hard.
That's not
Um,
hard at all. You just have to know how to say it.
yeah.
What's up?
I have a few questions about my current situation.
Yeah.
So right now I just started studying for MCAT. I plan to take that next spring.
Okay.
And then immediately after that, I plan to apply for Peace Corps. So that'll be 2 years, and I'm going to immediately directly apply to med school after that.
Okay. Don't take the
And
MCAT next spring.
okay, really? It won't
Yeah.
be good?
No, because your score potentially will expire. If you have any change in your plans, MCAT scores expire typically after sometimes 2 years, but mostly 3 years for medical schools. Why do they expire? I have no idea. They just want more money. I don't know, whatever. But yeah, it's very common for someone in a very similar situation to yourself of like, I want to take the MCAT when the knowledge is fresher, and then I'm gonna go do this thing, and then I'm gonna come back and apply. But let's say you really like your thing, and maybe you're able to extend for a year with the Peace Corps. I don't know how it works. And now all of a sudden your MCAT score is not good. Or you apply, you don't get in, you have to reapply, but now your score is expired and you have to reapply and take the MCAT again. So I don't recommend if you're going to take a couple years in between.
Thanks for letting me know, because I was like, maybe I'll get by because it'll be just a little over 2 years.
Yeah. I mean, potentially. And I just, it's too much of a risk for me to recommend it. But
yeah,
you make your own risk assessment and go, I'm going to go for it.
Okay, now I trust your judgment. What about the letters of rec? Do you think I should get them now and have them re-sign in a few years when I get back, or?
Yeah, so generally what I recommend, whether you're a first year student or someone in your situation where you're going to go take some time off, is go to your professors, go to whoever your letter writers are and say, hey, I'm applying to medical school in a couple of years. Can I stay in contact with you so that when I apply, I can ask for that letter? So that way it kind of gives you permission to stay in touch with them. They can kind of hear about your journey. Potentially some of that stuff can go in the letter, whatever have you. So that's generally what I recommend. Ideally, best case scenario, for whatever dumb reason, letters of recommendations we recommend are dated the year of your application. It shows that you're actively engaged with the letter writers. And so,
yeah, that's why I was like, should I have them re-sign? Because I'm pretty sure they would, but, and is it all right to ask because one of my professors I want to ask for letter recommendation. I'd like to ask for one for both Peace Corps and med school, but is that too much, you think, to be asking someone?
I'm not sure I understand the question. Ask that again.
Okay, so pretty much I'm having trouble figuring out which professors to ask for a letter of rec. I have one for sure, and I wanted to ask her to write me a letter of rec for both Peace Corps and also for med school. Do you think that's too much to ask her to write two? Or
I was super confused for a second.
Yeah,
right, so
but she'd be great for both.
Yeah, so one letter writer writing you a letter for the Peace Corps and then going back to her going, hey, thanks for that letter for the Peace Corps. Can you write me one for med school? I think it's perfectly fine because the likelihood is they'll change a couple words and it's mostly the same letter.
Okay, perfect. I didn't know if that was too much to be putting on someone.
Nah, I think it'll be all right. And be honest, be like, I'm so grateful that you wrote me this other letter. If it's not too much of an ask, can I also get a strong letter of recommendation for med school?
Yeah. So, okay. Thank you so much.
Yeah, you're welcome. All right. Rishab, hello.
Hi, Dr. Grant. I was just wondering if there's a certain number of hours that someone should be shadowing to be, well set for medical school, and how many different specialties someone should shadow under?
More than zero and more than zero. That's the answer. So shadowing is one where I think some students get super crazy with hours. They're like, I have 3,000 hours of shadowing experience. I'm like, great. That's probably 2,950 hours of boredom, because shadowing gets pretty boring after a while. You're like, I'm just hanging out, watching what's going on, not super engaged. So clinical experience definitely, I would say, trumps shadowing in terms of, if you only have time to do one, then clinical experience, actually putting yourself around patients. But having some shadowing experience, having some potential recency in shadowing experience is more important than anything else.
Okay, thank you.
You're welcome. All right. Amber, hello. The name made famous by the Amber Heard Johnny Depp trial.
Hi, can you hear me?
I can.
So my question was that I graduated with my bachelor's pre-med fall 2020. Then I had a baby, so basically I had a year off and I wasn't been actively engaged with my professor. So is it okay if I ask other people for my recommendation letters as I'm applying this cycle?
You've only been out of school for a year?
Yes. So I took 2 classes as postbac in fall 2021.
Okay.
But I basically graduated fall 2020.
Yeah. Yeah. So most schools will still want whatever their normal requirements are. So some schools will say if you've been out of school for a year, I know Sam Houston State says if you've been out of school for a year, they'll accept alternative letters. But a lot of schools will have different numbers, whether it's 2 years, 3 years, 5 years in terms of cutoff. So this is one of the most annoying parts of this process, is you're going to have to reach out to the individual schools to ask, check their website first, but then ask, say, hey, I've been out of school for a couple of years now. I haven't been in contact with my professors. Can I use alternative letters, whatever they may be?
And just a follow-up question, am I considered a non-trad at this point, or am I still a
doesn't matter what
Oh,
label you
okay.
want to put on yourself.
Okay, awesome. Thank you so much.
Yeah. Got all the peoples with babies today. I love it. Yeraldi. I'm going with Yeraldi.
Geraldine. Yes.
Yeraldi with it like a J?
Yes.
Oh, why you gotta make it hard like that? Come on.
Ask my mother. I don't know.
Thanks, Mom, for a lifetime of correcting people.
Exactly.
Hello, Geraldi.
Hi. I just want to know, because I'm a non-traditional student and I've been in and out multiple times out of my control of school. And I'm part of the OPC club as well.
Welcome.
And then, thank you. And I have a 3.0 right now, but I haven't taken organics. I'm taking it next semester.
Okay.
So needless to say, I am scared. So I was thinking
Why
about.
are you scared? You haven't even taken it yet. Talk about being part of the OPC. You're like working yourself up for something that's way down the line.
I've seen it. I've seen already enough.
I've heard the horror stories. I've seen the graveyards of Premeds past.
This is exactly the classes that people use to weed out those students. So I just want to know, because I'm thinking about doing obviously the postbac, and I want to see what you think, what med school actually think about that, because like, is it okay? Like, do they see it like maybe the student actually trying harder? Because I have an upward trend right now.
Good.
But like I said, I haven't taken this organics, so
yeah.
I just want to
So
know.
I don't understand what your question is.
So I want to know what med schools actually see postbac, student with postbac.
So your question is specifically about how do med schools view postbacks?
Correct.
They view them as the student who needed either to take science courses because they didn't take science courses, so a career changer typically, or someone who needed grade enhancements, someone who struggled early on and needed to take some extra time, needed to figure things out, needed to whatever, and finally figure it out. The ultimate goal doesn't matter. Did you need a postbac? Did you not need a postbac? Did you need a master's program? Did you not need a master's program? The ultimate question is, show me the money, right? Show me that you can do well.
Okay. Oh, okay. I thought like since you would do like a postbac, then it means like you needed more time. They will probably like judge you harder for that.
Potentially, but you can't dictate how they're going to judge you. All that you can do is prove that you're academically capable. And how they're going to judge you is how they're going to judge you. You can't control that. So why waste time thinking about it? Unless you're an official member of the OPC.
That is true. Thank you so much.
You're welcome. Oh man, I really need, we need some stickers. We need something. Julie Jackson, what's on?
Hello. Thanks so much. So I'm currently doing a master's degree in Europe, and I'm planning to apply to medical school next cycle, but I'm considering staying abroad for that year while I'm applying. I know you don't have a magic ball, but do you think that interviews will probably remain online in the coming cycles, or do you think they'll go back to in-person?
Yeah, so I don't have a magic ball, a crystal ball. I know from just hearing through the grapevines that it seems like most places are still likely going to be virtual this cycle. And I think just as we continue on, we're going to get more and more in person moving forward, is my assumption, just knowing kind of human nature of people want to get back to a homeostasis of this is the way things were. And so this is the way things will be. Unfortunately, I am a huge believer in virtual because it is more equitable for everyone. But I don't know. I don't have faith in people.
Yeah, thank you so much. I appreciate it.
Yeah. All right. Carla, again, welcome back. Carla's like an official member of the OPC with 3 hand raises today.
I am. Completely. So I wanted to ask, I've been doing hours in 2 crisis lines since the pandemic. And it's almost been a year in one of them. And then the other one, it had a long training. So I started a year, but I only started working with them after training about 3 months ago.
Okay.
Do those count as clinical hours or just as engagement hours?
So I would count them as clinical. I would put them on your application as clinical and let the med schools determine what they're going to do with it.
But if they were to count them as clinical, would I get in trouble because I labeled them as clinical?
I think you can only control what you can control. And if you want to present them as clinical experience and how you talk about them sounds very clinical, then they may get mad at you going, huh, what does this person think? This isn't clinical. But you can't control that. So it's the same thing with pharmacy technician. I don't think pharmacy technician is a clinical experience job. Lots of pre-meds market as clinical experience. If I personally saw it on an application, somebody put pharmacy tech as clinical experience, and I'm looking at it, I would just go, yeah, I don't really consider that clinical. I would kind of mark it off either if depending on what the official procedures are at that medical school, if they can mark off the total number of clinical hours. If I saw that you didn't have any other clinical experience, then I would be concerned. But it wouldn't typically be like, oh, I'm mad at you because you mark this clinical and I don't agree with you.
So it would just depend on the school themselves.
that's the answer for almost every question that you guys ask. All right, folks, we're at an hour. I do need to end. I do have a meeting that I have to run to. First, Zoom eShadowing. eShadowing is changing. It'll continue to change. I will be hosting less. We have some interesting thoughts to let students host. Potentially, it's just we had this thought of like, right, this hypothesis of if students brought on mentors, if students brought on friends, family members, whatever, would there potentially be a little bit more passion to ask those questions, to whatever? So we're still working on figuring these things out, but we have all the old eShadowing. If you're new to eShadowing, we have all the old eShadowing that you can go watch, and you can count towards your hours. Again, everything in the application is an honors-based system. You're just keeping track of hours yourself. We do have Mapped app that you can try and track your hours for free, and just do all that there. So yeah, that's what I got for you. I hope you have a wonderful day. We'll see you next time. Bye-bye.